Heart is truly remarkable, beating over 40 million times each year and pumping more than 7,500 liters of blood daily. It's the first organ system to become fully functional in the developing fetus, typically by the 8th week of gestation. Despite its resilience, cardiovascular disease remains the leading cause of death worldwide, accounting for about a quarter of all deaths in the United States. This surpasses even all cancers combined. Understanding the heart's normal structure and function as well as the diseases that can affect it is crucial for tackling this global health challenge. In this video, we'll explore the heart's anatomy, how it works, what happens when things go wrong, and the latest advances in treatment. Let's begin our journey at the very core of human life. Adult heart weighs about 250 to 360 grams, making up just 0.5% of body weight, yet it powers the entire circulatory system. Its muscle cells or myocytes are arranged in unique patterns. The left ventricle's spiral design enables powerful contractions, while the right ventricle is built for low-pressure pulmonary circulation. The heart's four valves, tricuspid, pulmonary, mitral, and aortic, ensure blood flows in only one direction. Beyond pumping, the heart also acts as an endocrine organ, releasing hormones like ANP and BNP to regulate blood pressure and fluid balance. Its electrical system, led by the SA node, keeps the rhythm steady while coronary arteries supply oxygen-rich blood. When the heart faces pressure or volume overload, it can enlarge, a condition called cardiomegaly. These intricate systems work together but are also vulnerable to disease. As we age, the heart undergoes significant changes. Its regenerative capacity is extremely limited, less than 1% of heart muscle cells renew each year. Over time, the left ventricular cavity may shrink, the septum thickens, and the heart muscle becomes stiffer due to increased connective tissue and amyloid deposits. Valves can calcify and become fibrotic, while coronary arteries may develop atherosclerosis. These age-related changes reduce cardiac efficiency and increase the risk of cardiovascular disease, especially in the elderly. The heart's ability to adapt is impressive, but these adaptations can also lead to problems like heart failure, arrhythmias, and increased vulnerability to stress. Understanding these processes is key to developing better strategies for prevention and treatment. Failure or congestive heart failure is a progressive condition where the heart can't meet the body's metabolic demands. Over 5 million Americans are affected each year, with high rates of hospitalization and mortality. The heart tries to compensate through mechanisms like the Frank-Starling law and neurohormonal activation, but these can become maladaptive. Hypertrophy, either concentric or eccentric, develops in response to pressure or volume overload. Eventually, this leads to capillary mismatch, increased oxygen demand, and electrical instability. Heart failure can manifest as left-sided, right-sided, or biventricular failure, each with distinct symptoms. Diagnosis relies on clinical evaluation, biomarkers like BNP, and imaging. Treatment targets underlying causes and includes lifestyle changes, medications, and advanced device therapies. Congenital heart disease arises from developmental errors in early gestation, affecting about 1% of live births. These defects range from shunts and valve abnormalities to complex malformations like tetralogy of Fallot and transposition of the great arteries. Many require surgical intervention and lifelong management. Ischemic heart disease, on the other hand, is caused by reduced blood flow due to atherosclerosis. Presents as angina, myocardial infarction, or sudden cardiac death. Acute events often result from plaque rupture and thrombosis. Advances in prevention and treatment have reduced mortality in high-income countries, but ischemic heart disease remains a leading cause of death globally. Both congenital and acquired diseases highlight the heart's vulnerability and the importance of early detection and intervention. Arrhythmias are disturbances in the heart's rhythm, ranging from benign to life-threatening. Causes include ischemia, fibrosis, and genetic channelopathies. Sudden cardiac death, often due to lethal arrhythmias, claims hundreds of thousands of lives annually. Modern medicine has developed devices like pacemakers, implantable defibrillators, and ventricular assist devices to manage these risks. These devices can restore normal rhythm, support failing hearts, and dramatically improve survival and quality of life. However, they also carry risks such as mechanical failure, infection, and thrombosis. The evolution of cardiac devices represents a major advance in the management of heart disease, offering hope to patients with previously untreatable conditions. Heart is a marvel of biology, balancing mechanical, electrical, and hormonal functions to sustain life. Cardiovascular diseases arise from complex interactions between genetics, environment, and aging, often manifesting through shared mechanisms like hypertrophy, dilation, and failure. Advances in genetics, surgery, and device therapy have improved outcomes, but significant challenges remain. Reflecting on the heart's multifaceted roles inspires ongoing research and innovation. By deepening our understanding of the heart's structure, function, and vulnerabilities, we pave the way for new strategies in prevention and treatment, moving beyond traditional lifestyle measures to embrace a future of personalized and precise cardiac care.